Welcome to Healthcare Simplified, a podcast from Deliver Health. Nothing's inherently simple about healthcare. That's why on Healthcare Simplified, we explore with today's top health leaders how to maximize ROI, staff satisfaction, and public health outcomes by building greater efficiencies into the healthcare connections that matter most between clinicians and technology, providers and patients, and people and their health. I'm your host, Mitch Holdick. Let's put simplicity to work together. All right, so welcome back. This is episode number 6 of Healthcare Simplified. Last week, we took some time to, it's kind of a departure from our normal podcast and topic or format, I should say. And we heard from some thought leaders at HCIC in terms of what some of the insights they captured, what things are keeping them up at night, what are their biggest challenges. And I thought it would be a good opportunity for us to pivot this week into meeting with a couple of folks that presented at HCIC on digital front door, building your digital front door without a product adoption plan, ... think again. And I loved this topic. I had a chance to sit through it and listen, and I was hoping that the presenters could meet with us and kind of go over some questions. So I'm joined by Chelsea Kleen, who's the Director of Health System Emerging Strategies at UT Southwestern Medical Center. Chelsea, thanks for joining us.
Thanks for having me.
And I'm also joined by Becky Mbimbo, who leads the Adoption Consulting Team at Deliver Health. Becky, thanks for joining us.
Thanks for having me.
And for our listeners, anybody that attended HCIC or knows somebody that attended HCIC, all of the content and presentations are available to download on demand. So I highly recommend you go and check out this presentation if you get a chance. And I think after today's podcast, you'll get a sense of what it entailed and hopefully will inspire you to go check it out. But some of the questions I had for you guys, and Chelsea, I'm going to start with you. Obviously, your role at UT Southwestern is focused on emerging strategies, and big focus is developing a digital front door. So who's really responsible for leading these strategies, and what does that mean to you, Chelsea, in your role?
Yeah, so our department leads the strategy of it from kind of the vision and getting all the different partners and stakeholders together. But it is kind of a group effort that's led by our marketing team, HSIR, and operations to make sure that the app remains a viable product for everyone, is up to date for the information throughout the system.
Awesome. Also, I loved in the presentation kind of your approach in discussion around working with different stakeholders and different departments that, historically have not really had to work together in this kind of orchestration. So I think that's really cool to see you leading this, but at the same time pulling together different teams for the greater good of the organization. That's really cool. And Becky, so you support various clients and customers around product adoption. What makes product adoption important from your perspective?
So I do lead product adoption, but product adoption you have to think about a little bit differently from a digital health perspective, especially when you're considering a mobile app. When you think of product adoption from a technology such as a CRM or another form of technology, you're really learning how to use the tool. For product adoption with Deliver Health, product adoption means getting the users to use the app. So it's important because if you don't have users, after spending the amount of money that you spend on building an app, what's the point of having it in market? So it's really important to have that adoption so that you can continue to improve and allow the users a great experience.
That's awesome. So it really goes beyond just the launch of the product. There really is kind of a sustainable approach to it.
Absolutely. You have to start thinking about product adoption when you start visualizing or having a vision in mind of what you want the app to look like. And
Sure.
Then through launch and then continued success, you always have to continue to want to improve and make it better for your users.
That's awesome. So Chelsea, question for you. We mentioned, last week our listeners got to hear from some thought leaders at HCIC. And one of the things I was really intrigued by you is your title. So emerging strategies is pretty unique in terms of what we're seeing from others in the industry. So tell me a little bit about what that means at UT Southwestern, emerge like that department and the kind of work you lead and how that came about.
Yeah, so our department's relatively new. I believe it started about 3 years ago, but ultimately needed a position in the organization that could understand some of the technology as well as the operational parts to identify new technologies, new patient care models, new digital tools that may be beneficial for patients, but having a lens of kind of a higher level to understand how that could be scalable, how we make sure that it can apply on a health system level and not so interdepartmental. So we evaluate and launch programs such as remote patient monitoring, e-consults, the mobile app, looking at other features such as e-visits, care companion, other items that are available as we have new releases in our MyChart, as well as other vendors who have products that we think would be beneficial for our patient population. And so our department really evaluates it, gets the buy-in from the different departments to either pilot or scale it after we've shown a successful pilot, working through the implementation as well as monitoring it and adjusting as we need as things kind of change and evolve throughout the health system.
That's awesome. So it sounds like that approach really allows you to evaluate the build versus buy, concept that I think a lot of hospitals and health systems, quite frankly, struggle with, knowing which direction to go. But it sounds like the emerging strategies department at UT Southwestern really, from a scalability perspective and a product assessment perspective, really helps kind of determine the best route to go.
It's that, and it's also whether we should pursue it. So there's a lot of new, cool technology and things that you can do, but should we do it? Do we have the buy-in to it? And is it going to provide the impact that we want? Is really what we want to make sure as we have limited resources internally, to lead these efforts, that we want to come with tools that we know are beneficial and have, the potential for success versus, piloting a lot of small things that, we really haven't thought through to say it's a really good thing to move forward with.
Yeah, it's just as important what not to do as it is important what to do.
Right.
Yeah, super cool. So question for both you guys, and I'll start with you, Becky. And as I mentioned, I just, listened to the presentation, and the biggest takeaway for me was the fact that it was roughly 6 months from vision to launch. And Chelsea, you talked about ideation to implementation to launch, and that whole process is 6 months. That's incredible. That's a really quick launch. So Becky, from your perspective, how'd you do it? How were you guys able to do that so quickly?
Yeah, so from contract to launch, it took 6 months. And how we partnered together was, honestly, Chelsea and the UT Southwestern team had an amazing plan already put in place. And with the support of adoption, it was really kind of thinking outside the box and what has worked for other customers or other clients that I've worked with in the past to be able to come up with some additional suggestions. And I really, truly believe, and Chelsea, you can correct me if I'm wrong here, but I truly believe it's the internal launch that really escalated the adoption of the app. They got the internal buy-in from the internal users, they got the feedback they needed, and that's really how it escalated. Chelsea, do you have anything to add to that?
I think the internal launch was something that we knew we needed to do. And I think in the long run, we're really glad that we invested the time to go personally to each department to make sure that they were aware, as well as ask any questions, concerns early on, and then allowing, all of UT Southwestern to feel like they could provide the feedback and that it would be incorporated within the launch and the features.
Yeah, that's actually a perfect segue into my next question, Chelsea. In terms of the kind of phased approach, and you did such a nice job of outlining that in the presentation, from internal stakeholders and then external stakeholders and all of the thought process that went into that. It really was kind of a change management as much as anything. And our listeners are all well aware of some of the disjointedness that happens in healthcare, specifically within departments that have historically not worked well together. So from your perspective, having gone through this, how were you able to initiate that change management and get buy-in from so many different departments within your health system?
I think a lot of it is that we had a lot of the existing relationships already based on some of the work that we had done. Since we're evaluating new technology and we're launching new programs, obviously our HSAR partners are with us through kind of that whole process, as well as we're in, the clinics or in the ambulatory setting where we're partnering with our ambulatory leaders and providers to pilot these types of technologies. And then ultimately we need to be able to market them once we have them out there. And so the relationships that we've built have been through other projects, as well as continuing to loop in the appropriate stakeholders for other initiatives, get people's feedback. So continuing to build on those relationships, I think was a big piece of it. And we make sure to actively go to department meetings and other things so people know what our department's doing, what's coming down the pipeline that they can be excited about. And so I think the relationships that we've built, as well as kind of that continuous touch base with the different departments, has been helpful, because we continue to do that, whether it's app related, e-consult related, any other technology that people are aware that we've been kind of launching and managing.
Yeah, and I remember as you were talking, I just remembered towards the end, I loved the kind of anecdote you shared where as you developed those relationships, when you worked with marketing, worked with other departments, when you were making asks, so to speak, in terms of helping to promote the app and helping to promote optimization, they were going above and beyond what your expectations were. Maybe you can talk a little bit about that.
Yeah, so I think we had an idea of where we wanted to put a snippet about the app, where we wanted to change text or information, but ultimately I don't own any of those locations, and our department can't make the updates ourselves. And so going to the different governance committees or the different owners to say, hey, can we put a snippet about the app here, more on a broad level, without saying, I want it to be right here front and center. And every time I was very fortunate that was the recommendation of, well, great, let's do a full website takeover, or let's put this on the cover page. And so I felt like people were excited about the app, were willing to put it anywhere and everywhere and replace things that I ultimately just asked, can I put it somewhere? And was always fortunate to get the response of yes, and let's put it these other 10 places.
That's really cool. Everyone just collectively kind of owned it and celebrated the app and the overall strategy. I just love that little takeaway from the presentation. So Becky, question for you. Product adoption obviously is a big focus of what you do at Deliver Health and was outlined really well in the presentation. And you talked about iCare as kind of the structure of that adoption strategy. Kind of a 10,000-foot overview for our listeners. What does that entail?
I appreciate you asking. So iCare is how it differs from others is it really focuses on the client specifically. I work with clients of many shapes and sizes, with one person on the team to 5 people on the team. And my plan really customizes to the need of that customer. Chelsea, like I had mentioned before, Chelsea had a great plan in place. And, I have clients that are much more mature in their digital health journey, digital health transformation. And then I have others that aren't really doing marketing at all, other than service line marketing. So it's really I do care about my clients and I want there to be ultimate success, and being able to customize the approach for each is why I think my adoption strategies are different from other organizations.
Yeah, and you mentioned, maybe you can talk to us a little bit about what has made UT Southwestern unique in comparison to other clients. Just to your point about the kind of custom approach. Any examples you can share that makes clients unique from each other?
Absolutely. So at UT Southwestern, their approach is retention. They're focusing their efforts on retention only. And I have other clients that really focus on patient acquisition or retention or both together. So when coming up with a plan, I really focused on areas that would focus on retaining the patients in the organization.
Got it. Chelsea, back to you. It was kind of in the beginning of the presentation, but you talked about, I think at one point, UT Southwestern had 4 apps roughly. Is that correct?
Yes, 4 patient-facing apps.
Patient-facing apps. And I did a little research before today's interview, and the industry standard is actually 3.8 apps. So you guys are not alone, as I suspect many of our listeners are in the same boat within their organization. So you talked about the ability and the need to consolidate those apps into one. Maybe kind of talk to us a little bit about why that's important and then how you were able to do that.
So after the video visit part, and then we had other applications that we were about to launch, the UTSW Go that I mentioned with wayfinding, as well as other kind of the shuttle application that allowed for transportation within the system. It just made sense to be able to have everything in one app so you didn't have to know about the other applications. You kind of get one product that's encompassing of everything that you could need when you interact with UT Southwestern, which was really the driving point to pull everything together into one app to make sure that everyone had what they needed when they came to campus or connected with UT Southwestern digitally.
And for our listeners, remind me the name of the app in case they want to check it out.
It is UTSW MyCare.
Okay. So I think what I found really interesting, and this is true with a lot of apps, but you guys do a really good job of kind of anchoring the app and the overall experience for your patients and community members with that patient portal. Epic is your EHR of choice at UT Southwestern, but it can be anything. And then it's actually wrapped around with different solutions like the wayfinding you mentioned. With that in mind and that concept, you guys collectively talked about the increase in MyChart adoption and utilization as kind of a product of the app and the overall digital front door strategy. So maybe Becky, I'll start with you on this one. First, are there any specific stats you can share with our listeners? The increase in adoption and utilization, and then second part, what do you think really played into that?
One of the stats that we have is for those that have an app with features wrapped around MyChart, we have always seen between a 40 to 60%, which is our goal. So if anybody were to start with adoption, 40% is one of our goals. 40 to 60% adoption of MyChart. Now, because MyChart is a separate component, it's an SDK within the app, we have to back into that number. So we can't 100% say for certain that because of the app, they have, the numbers have increased, but we have seen an increase across all of the clients that I work with that, for example, another client that I work with had a 30% MyChart mobile adoption. And once we started adding in some of the components of the adoption support, we saw the increase from 30% to 55% in November, so 9 months.
Wow, that's awesome. So Chelsea, from where you sit, I know that MyChart adoption and utilization is really important. I mean, there's typically committees or groups that are focused on this. Do you think stakeholders within your organization are kind of connecting the dots that this digital front door strategy and mobile app specifically has really helped us with adoption and utilization of MyChart? Do you think people are connecting dots on that?
I think we've always had a really high adoption of MyChart as a whole. So I do think that our organization has done a lot of efforts to increase that. I know we have one of the highest adoption rates of MyChart. I think the big piece is MyChart Mobile and, pushing the mobile version of it, which is now UTSW MyCare, has been a big thing that we've been looking at we have a high MyChart adoption. We want to grow the mobile user base into MyCare just because we did have, we used the COVID vaccine scheduling was all through MyChart. The video visits are all through MyChart. And so with the pandemic, it really just pushed MyChart as a whole. And so now, putting that in the MyCare app as a feature, we think is beneficial, that people will transfer over and kind of convert from MyChart mobile, but also MyChart web browser to the mobile app of UTSW MyCare.
Awesome. Well, this has been awesome. I really appreciate your time today, Chelsea and Becky. And again, a reminder for our listeners, if you attended HCIC or know somebody that did attend the conference, their presentation is available to download. They will also be doing a repeat performance on other platforms. So give us a follow or check us out at deliverhealth.com for more information. And for our listeners, Chelsea, how can folks connect with you if they have questions?
You can feel free to reach out to me on LinkedIn, Chelsea Clean, or you can email me at chelsea.clean@utsouthwestern.edu.
Awesome.
And same question for you, Becky. How can our listeners connect with you?
You can connect with me on LinkedIn, Becky Imbimbo, and that's IMBO, or you can email me, becky.imbimbo@deliverhealth.com.
Great. And we'll put all your contact info in the show notes as well. So thank you guys so much for your time, and we will talk to you soon.
Thank you.
Thanks again for tuning in. If you like what you heard, please share, rate, and review on Apple, Spotify, or your favorite podcasting platform. For more content about simplifying healthcare, visit deliverhealth.com/resources, where you'll find our blog, videos, and much more. We'll see you next time on Health